welcome to our YouTube channel. I'm Dr. Kosarli. Friends, today's topic is sickle cell disease. What is the sickle cell disease and what is the symptoms, what is the reason of sickle cells and what is causes and treatment of sickle cells. But friends, if you not subscribe my channel, please subscribe my channel. You see red color subscribe button, please click and bell notification like button and be healthy. Please subscribe my channel. Sickle cell anemia is an inherited red blood cells disorder in which there aren't enough healthy red blood cells to carry oxygen throughout your body. Normally, the flexible round red blood cells move easily through a blood vessel. In sickle cell anemia, the red blood cells are shaped like sickles or crescent moons. What is sickle cell disease? Sickle cell disease is a group of disorder that affects hemoglobin, which is responsible to deliver oxygen to the cell of the body. It is an inherited disorder where the abnormal hemoglobin molecules called hemoglobin S distort the red blood cells RBC into the sickle or the crescent shape. Sickle cells are less flexible and hence break while passing through the small blood vessels. They survive for the only 10-20 days compared to the normal RBC, which live up to 90 to 120 days. This results in the reduced RBC count, leading to anemia. What causes sickle cell disease? Autosomal receive inheritance the hemoglobin S gene, which is responsible for the alterant hemoglobin and red blood cells, is passed on when both the parents must carry the gene's mutation and it affect male and female equally. This is known as the autosomal receive pattern inheritance. Autosomal means that the mutation is not unique to the X or Y chromosome and can therefore affect the males and female equally. Receive means the mutation must be present in both the father and mother in order for the child to have sickle cell disease. Both parents are usually asymptomatic and may not realize that they are the carriers of mutations. When both parents are asymptomatic genetic carriers of disease, each child has the chance of 25% equals two defected genes suffer from sickle cell disease. 50 equals one defected gene and develop sickle cell disease trait. The asymptomatic but genetic carriers of the diseases 25 inherit two normal genes and be unaffected by the genetic mutation and disease. Friends, sickle cell disease is a condition in which red blood cells are not shaped as they should be. Red blood cells usually look like round discs, but in sickle cell disease, they are shaped like crescent moons, are old farm tools now as the sickle cells. Sickle cells, these sickle shapes will get stuck together easily and block off small blood vessel. When blood get to where they should, it can lead pain and organ damage. Sickle cell disease is not contagious, so you can't catch it from someone else or pass it to another person like a cold or infection. People with sickle cell disease have it because they inherited two sickle cell genes, one from each parent. In some types of sickle cell disease, people can inherit a sickle cell genes from one parent and different abnormal hemoglobin gene from the other parent. A person who inherits the sickle cell gene from only one parent will not develop the disease but will have the something called sickle cell trait. People with sickle cell trait often don't have any sign of disease, but they can pass sickle cell gene to their children. What are the main signs and symptoms? Sickle cell disease is present right from infancy. However, infants mostly do not show symptoms until 5 or 6 months of age. Symptoms are seen early age or the later stage of life. The early symptoms include jaundice and Asterias, paleness of eyes due to hemolysis of RBC, fatigue due anemia, dactylitis, which painful swelling of hands and feet. The late symptoms include acute pain any part of the body, mostly more than one spot at the time due to low oxygen supply by the blood. Many adolescents and adults suffer from more severe chronic pain. Type of sickle cell disease. Sickle cell disease is an umbrella term used to describe a group of genetic diseases that affect the body's hemoglobin. Hemoglobin is the protein in red blood cells that carries oxygen. It is made of the two alpha globin chains and two beta globin chains. Sickle cell disease is caused by the mutation in the beta globin gene, resulting in an abnormal hemoglobin called sickle hemoglobin or HbS. Different type of sickle cell disease arise based on the whether the hemoglobin beta S gene is inherited with another beta S gene or whether different beta gene in the mutation. Hemoglobin SS disease. Hemoglobin SS disease is the most common and most severe type of sickle cell disease. It occurs when you inherit the hemoglobin S gene mutation from both parents. In this type, the body only produce hemoglobin S. This type is often called the sickle cell anemia. Hemoglobin SC disease. Hemoglobin SC disease is the second most common type of sickle cell disease. It occurs when you inherit the hemoglobin beta S gene from one parent and the hemoglobin C gene from the other. Individuals with hemoglobin SC disease may have the similar symptoms to the individual with hemoglobin SS disease. However, the symptoms may be less severe. Hemoglobin ST, hemoglobin AC, and hemoglobin SO. These type of sickle cell disease are less common and are usually less severe. Hemoglobin Sb plus beta thalassemia. Hemoglobin Sb plus beta thalassemia occurs when you inherit the hemoglobin beta S gene from one parent and a hemoglobin beta plus thalassemia gene from other parents. In this type, some normal beta hemoglobin is produced but reduced amounts because the body produces some normal hemoglobin. This from the sickle cell disease. Sickle cell disease is less severe than hemoglobin SS disease. Symptoms are usually milder than hemoglobin SS or SC disease, but complication can still develop. Treatment sickle cell disease. Sickle cell disease usually require lifelong treatment. Children and adults with sickle cell disease are supported by a team of different healthcare professionals working together at specialist sickle cell center. Your healthcare team will help you learn more about sickle cell disease and work with you come up with an individual care plan that takes into account all your needs health concern. Stem cell or bone marrow transplants are the only cure for sickle cell disease, but they are not done very often because of the significant risk involved. Stem cells are the special cells produced by bone marrow and spongy tissues found in the center of some bones. They can turn into different type of blood cells. For a stem cells transplant, stem cells from a healthy donor are given through the drip into a vein. These cells then start to produce healthy red blood cells to replace the sickle cells. A stem cells transplant is an intensive treatment that carries a number of risks. The main risk is the graft versus host disease, a life treating problem where the transplant cells start to attack the other cells in your body. Stem cell transplants are generally only considered in children with sickle cell disease who have the severe symptoms that have not responded to other treatments. When the long-term benefit of transplant are thought out to outweigh the possible risks. How is it diagnosed and treated? Sickle cell is diagnosed mostly during pregnancy or at the time of birth. You are more likely to get the disease if there is a positive family history. Few tests are performed to diagnose sickle cell disease. Complete blood count, hemoglobin electrophoresis to check for abnormal hemoglobin, urine analysis, acute infection, chest x-ray, acute pneumonia. Treatment is by blood and bone marrow transfusion to prevent painful episodes. You should be drink plenty water and avoid sudden temperature changes. Analgesics are given to relieve severe pain. Prevention of sickle cells disease. Drink plenty water. Try not get too hot or too cold. Try to avoid palace situation that gets exposed to high altitude, for example flying mountain climbing cities with high altitude. Try to avoid palace situation with exposure to low oxygen level, for example mountain climbing, exercising extremely hard such the military boot camp. Sickle cell disease diet. Eat from a rainbow of fruits and vegetables paired with grains, proteins such as eggs, fish, chicken, lean meat, beans or tofu and nuts. Get plenty of calcium-rich foods such as low-fat, fat-free milk, yogurt and cheese, leafy green vegetables and calciums, fat-filled foods such as soya milk, orange juice and tofu. Friends, this is the sickle cell disease videos. If you like these videos, please subscribe channel and like and comment. Thank you for watching.